So I'd like to talk about how relapse happens, as it's a question that's often asked. So relapse is a process that can start days, weeks, or even months before the event of an actual relapse. There are stages to a relapse that, if left untreated, will ultimately lead to a person relapsing. Some of the signs of a relapse in the early stages are anxiety, intolerance, anger, defensiveness, mood swings and isolation, not asking for help, not going to fellowship meetings, poor eating and sleeping habits. At this stage of early relapse, it is important to practice self-care. Learn to practice relaxation techniques to cope with anxiety and anger. Attend fellowship meetings so you can share with others who have experienced a similar process of addiction and, importantly, recovery, and can help support you with developing hope, faith and courage. Ensure you are allowing yourself enough time to rest and eat properly. If you don't change your behaviour at this stage and live too long in the stage of emotional relapse, you'll become exhausted and may feel resentful. This in turn will cause you to want to escape and move into the place of mental relapse. In mental relapse, there's a war going on in your mind. Part of you wants to use and part of doesn't. As the stages of relapse continue, the signs to look out for are thinking about people, places and things you used with, glamorizing your past, lying, hanging out with old using friends, fantasizing about using, thinking about relapse, planning your relapse around other people's schedule. It gets harder to make the right choices as the pull of addiction gets stronger. Some ways of dealing with mental urges are: play the tape through. When you think about using, the fantasy is that you'll be able to control your use this time. You just have one drink. But play the tape through. One drink usually leads to more drinks. You'll wake up the next day feeling disappointed in yourself. You may not be able to stop the next day, and you'll get caught in the same vicious cycle. When you play that tape through to its logical conclusion, using doesn't seem so appealing. A common mental urge is that you get away with using because no one will know if you relapse. Tell someone that you're having urges to use. Call a friend or someone in recovery. Share with them what you're going through. The magic of sharing is that the minute you start to talk about what you're thinking and feeling, your urges begin to disappear. They don't seem quite as big and you don't feel as alone. Distract yourself when you think about using. Do something to occupy yourself. Call a friend, go to a fellowship meeting, get up and go for a walk if you have to. If you just sit there with your urge and don't do anything, you're giving your mental relapse room to grow. Do your recovery one day at a time. Don't think about whether you can stay abstinent forever. That's a paralyzing thought. It's overwhelming even for people who've been in recovery for a long time. Once you start thinking about relapse, if you don't use some of the techniques mentioned, it doesn't take long to go from there to the actual physical relapse itself.